completely fascinating intersection in modern medicine. We're talking about a massive paradigm shift, where the raw, incredibly fast data processing power of artificial intelligence is finally meeting the highly specialized clinical expertise of healthcare workers. And the real story here isn't some sci-fi man versus machine scenario. It's about man and machine actually working together to totally reshape the future of healthcare.
But of course, as these algorithms get scary good at detecting microscopic changes in tissue, the anxiety in the medical community is very real. It begs the question, is this technology just a super-powered assistant, or is it a straight-up replacement? Well, today we're going to unpack the hard data, look at the actual clinical technology, and dive into a massive 2026 survey of radiology professionals to get some real answers.
Welcome to this explainer. We're going to take all the latest research and clinical data and transform it into a clear, visual guide on the future of medical imaging. Our goal is to make these complex technological advancements incredibly easy to understand.
Okay, here's our roadmap for the explainer today. We'll start with the new imaging revolution, track AI across the scan journey, explore precision drug therapy tracking, look at automating the clinical workflow, dig into some real perceptions and valid fears, and finally wrap up with the human-centric radiographer.
Let's jump right into Section 1, the new imaging revolution, where we're literally seeing the unseen.
Get this, one of the most mind-blowing concepts happening right now is synthetic modality transfer. Basically, AI is generating an entirely new type of scan, like an MRI, derived entirely from the data of an existing CT scan. It's kind of like taking a standard 2D photograph and using AI to perfectly predict what the entire 3D model looks like. For the patient, this is a total game changer. It means less time stuck in the hospital, way less anxiety, and incredibly fast diagnostic results.
Moving on to Section 2, let's look at AI across the scan journey and how it's transforming every single step.
You see, AI doesn't just look at the final picture anymore. It intervenes smoothly across all 4 of these critical phases to ensure maximum efficiency. From the very second a patient's referral comes in, to planning the scan, capturing the actual image, and finally processing all that data, AI is just working silently in the background.
It's really doing the heavy lifting on these incredibly precise, time-consuming tasks. For instance, it calculates perfect isocentric positioning, which is basically finding the exact center of the scanner for a patient's specific body. That improves image quality while actually lowering the radiation dose. It can optimize exactly how much contrast dye a patient needs, and it even automates fetal and kidney measurements and ultrasounds, which used to rely entirely on a human operator. By automating all of this, departments can drastically increase how many patients they see while keeping safety and quality top-notch.
All right, on to Section 3, precision drug therapy tracking, taking us way beyond just the initial diagnosis.
When you look at the 2026 survey data of professionals in the field, the confidence in this tech is just massive. 65% agree that AI is moving past just saying, hey, here's a problem, to actively evaluating how well a treatment is actually working. That is a massive leap forward.
And it makes total sense when you break it down by specialty. In oncology, AI models are quantitatively tracking tumor volume and these tiny vascular changes to see if chemotherapy is shrinking a tumor way before a human eye could ever catch it. In neurology, machine learning spots tiny tissue alterations that signal an early ischemic stroke within an impossibly small time frame. And in urology, deep learning algorithms evaluate MRI texture and shape to detect advanced prostate cancer, potentially saving patients from unnecessary biopsies. AI just sees microscopic patterns that we literally cannot.
Let's shift gears to Section 4, automating the clinical workflow with the Whisper and Gemini CDSS. This is where the tech stack gets super interesting. This outlines a modern clinical decision support system that's popping up in recent technical literature. It leverages OpenAI's Whisper, specifically fine-tuned on over 500 medical audio samples, to get highly precise medical speech to text. Then, it uses Google's Gemini API to instantly translate that spoken audio into a perfectly structured diagnostic report. Imagine a radiologist just speaking their observations aloud, and the system automatically categorizes the whole shebang. No more hours wasted drowning in the absolute nightmare of manual data entry.
Which brings us to Section 5, Real Perceptions and Valid Fears, looking deeper into that 2026 survey data. On one hand, the enthusiasm on the ground is totally undeniable. A rock-solid 74% of surveyed radiology professionals are entirely willing to use AI tools in their daily clinical practice. They see the benefits, and they are fully ready to jump in. Yet, there is this incredibly sharp contrast hiding in that exact same data. 40% of those professionals express a genuine, deep-seated fear that AI might eventually replace their jobs entirely. It's a fascinating dichotomy, right? They really want to use the tool, but they are also deeply intimidated by just how capable the tool is becoming.
When we impartially analyze the survey, you can see exactly where the optimism is coming from. 72% agree it improves diagnostic accuracy, 70% see enhanced workflow efficiency, and 68% believe it reduces their workload. The benefits are totally clear and quantifiable. The fear of job replacement, though, that's rooted in just how shockingly fast this automation is advancing across all these areas. And we absolutely cannot brush past this. 35% of professionals are raising tough but necessary ethical questions. Things like, who actually owns this patient data? How transparent are the algorithms making these life-altering predictions? And ultimately, who is held accountable if the AI makes a flawed clinical decision? These are massive, critical hurdles the healthcare industry absolutely has to clear to make sure AI is integrated responsibly.
And that leads us perfectly into our final section, Part 6, the human-centric radiographer, and why they are the irreplaceable element.
When you put the cold, calculating efficiency of AI right up against the warm, empathetic nature of human care, the future actually becomes crystal clear. A machine can synthesize data perfectly, but it cannot hold a frightened patient's hand. It cannot look them in the eye, explain radiation risks, provide genuine empathy, or obtain true informed consent. Actually, as AI takes over more of the technical processing, the radiographer's role is just going to shift heavily toward these irreplaceable, patient-facing duties.
So how do we safely bridge this gap? Well, the education system has to evolve. An overwhelming 82% of professionals are practically begging for AI training programs. We're looking at a near future where radiographers have to shift away from just knowing one type of scanner. They'll need cross-modality competence, meaning they aren't just experts in one specific machine, but rather managers of a whole suite of intelligent systems. They're going to need to understand the statistical underpinnings of how AI makes decisions so they can critically assess what the machine is telling them.
By empowering healthcare workers with AI literacy, we completely shift the narrative. We move away from this dread of job replacement, and we step boldly into an era of new education, new skills, and incredible new possibilities. There's this great saying, today's learners, tomorrow's leaders in healthcare. The professionals who actually take the initiative to understand AI, to learn its limitations, and to work hand in hand with these algorithms, they aren't going to be replaced. They are going to be the ones leading the future of highly efficient, personalized medicine.
So, I want to leave you with this final thought to ponder. As the machines inevitably take over the heavy lifting of data analysis, image processing, and automated reporting, are we prepared to step up and double down on the human connection that truly heals? Thanks so much for joining me for this explainer. Keep learning, and I'll catch you on the next one.